I think neck liposuction is an outdated procedure. And if you're curious to know why, keep watching this video. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I used to do neck liposuction all the time. Back when I was in training, it was pretty common to do, especially in younger patients, but sometimes even older. And we're all starting to see the repercussions of that now, especially those of us that do a lot of neck lifts and facelifts. You can do neck liposuction a number of ways. One is just a regular liposuction cannula. So a lot of people do this in the office. It can be subtle or very aggressive. I have a device in my office called FaceTite. And what that does is a cannula that goes underneath the skin that the probe delivers heat energy to both melt fat and tighten skin. And I think it's one step up from plain neck liposuction, because one problem with neck liposuction is that you develop loose skin over time. So it can tighten the skin a little bit, but subtly. So it's not going to be like a neck lift type result. The amount of fat reduction you get is dependent on how much energy you deliver, as well as if you go in after the treatment and do a little bit of extra neck liposuction. I usually do that to clear up a little bit of melted fat. Now, this is only good for certain individuals, usually someone in their 20s, maybe 30s, who has a lot of subcutaneous fat. Neck liposuction or FaceTite only addresses subcutaneous fat, not fat deep to all the muscles in the neck. So if you genetically have deeper fat pockets in the neck, it's not going to do anything for that. But it does work for some people. Now, what I am seeing lately are women coming to me who are really younger, who shouldn't really have a lot of significant skin laxity yet, but they've had overly aggressive neck liposuction. And so they have loose, crepey skin under here. It's because nothing was really done to tighten the skin. And fat isn't the only problem there, even if you don't have deeper neck fat. So recently I had a patient come to me in her 30s for a face and neck lift because of this very issue. And probably if she never had neck liposuction, she wouldn't have needed it. But because she had overly aggressive fat reduction in her neck, she really actually needed a neck lift. And not even a structural neck lift where I go in and take deeper pockets of fat out, reduce glands, muscles, things like that. She just needed the skin tightened. It made her neck look older than what she actually was. There are other people that think they need neck liposuction, but what they really need is a structural neck lift. Now, who's a good candidate for a structural neck lift? Most people, unless they're really overweight, which we're generally not doing surgery on, most of their fat pockets are deep to the platysma muscle. So the platysma is this muscle here that goes all the way across the neck. I go underneath that muscle and reduce fat. Depending on the dynamics of your chin, your tongue movements, and speech, you can carry tension in the muscles in the neck as well, and the muscles underneath the tongue and deep in the neck. And what that does is cause hypertrophy of those muscles. So if you have a recessed chin, that tends to happen, or someone habitually thrusts their tongue forward, which some people do, and there are speech therapists that help those individuals to retrain their tongue motion to not thrust forward all the time. But some of those motions can cause the digastric muscles and the platysma to become quite enlarged. So sometimes in a structural neck lift, I'll trim those. And sometimes in addition to fat and muscle reduction, I'm also reducing submandibular glands. And so to get that nice snatched jawline, I am not just reducing one component. I'm addressing everything and then tightening the skin at the end. And you know, it's easy to think that you can get a great result with a quick in-office procedure, but sometimes it's not that easy. And sometimes you're creating more problems by trying to do those smaller procedures rather than just doing the right one right off the bat. So for sure, if you're in your 40s and above, I definitely would not recommend getting neck liposuction. If you're younger than that, I would proceed with caution. And whoever you're going to, who's going to do your procedure, you really want a more comprehensive evaluation of what's causing fullness in your neck. And they should be able to do any option to give you a good result in your neck, whether it be minimally invasive procedures or a structural neck lift. And sometimes even facial plastic surgeons don't go as far as debulking the deeper structures in the neck. So not all facial plastic surgeons even are created alike. So just do your research, look at before and afters, make sure they're long-term before and afters, because sometimes even in the first couple of months, the results look really good. But if you look at the 1-year results, everything has sort of relaxed back. That's when you see the skin laxity. So I hope this helps you make some decisions if you're thinking about neck liposuction. Don't forget to like this video and subscribe to the channel for more helpful information.